So my name is Kim, and I tend to spend a lot of time on people's thoraxes and trying to make them as mobile as possible. So something that I've done or I've learned with my patients is that breath is really important to improve the mobility of their rib cage. So when you're having a tough day, when you feel like your shoulder girdle is really tight or your shoulder blade is tight and your mid-back is really stiff, these breathing exercises can be really helpful in regards to calming down pain, calming down muscle tension. All right, so when we think about breath, there's lots of things I think about, but what I start with is getting my patients to be aware with the breath that they have. So I get them to focus. Jill, you're going to do 2 breaths in your belly. And then by the time I'm done with this, she's going to figure out which is her hardest breath. And then you're going to do 2 breaths along your kind of side of your rib cage, kind of your bra line there. Good. And then you're going to do 2 breaths way up here. So this is your apical breath. All right. So everyone's different, so her apical breath might be really tight compared to my lateral breath, but I wonder which one is the hardest for you? The apical breath. So that's what I want to get her to put her awareness in. So I want you to focus on your apical breath. And once you kind of get a hang of that, so maybe 2 or 3 breaths, then you can think about symmetry. So is the right side expanding as well and as open as your left side? Which side's heavier? Left side's heavier. Okay. So then I want you to think about opening that left side to meet and match the fullness of the right side. So this might change with her daily. So she might have to retest this with a belly breath, a side breath, and an upper breath. And she might find that tomorrow her lateral breath might be stiffer, and that's where she's going to put her awareness. So after she's worked on that breath, you also want to think about front body versus back body. So Jill, when you take a breath in, do you feel like it's harder for you to bring along the front of you versus the back?
To the back.
The back. Okay, so now her point of awareness or her focus is going to be on back breath, on her upper chest, and trying to lengthen that whole system. So every time we take an optimal breath, we actually mobilize the individual joints of our spine and our ribs. And so just by focusing on focused breath, you can actually mobilize just as I would treat you as I mobilize you, or just as a chiropractor would mobilize you, but now you have the control to do that yourself.